Few practices from the annals of medical history evoke such a visceral reaction as lobotomy. In 1935, Portuguese neurologist and inventor of cerebral angiography, Dr. Egas Moniz, pioneered the frontal leucotomy procedure in humans by drilling holes into a patient's frontal lobe and injecting alcohol into their brain. Later, Dr. Moniz developed a specialized instrument he called a leucotome that had a retractable wire loop with which he could remove cores of white matter from the frontal lobes. Dr. Moniz published a paper touting the procedure's effectiveness on 20 post-op patients, and in 1949 he won the Nobel Prize in Physiology or Medicine. Less than a year after reading Moniz's monograph, an American neurologist named Walter Freeman, accompanied by neurosurgeon James Watts, performed 20 frontal lobotomies over a 2-month period. Dr. Watts used a manual cranial drill to burrow through the skull. With Dr. Freeman verbally guiding his movements, he cut the nerve strands between the frontal lobes and the thalamus. Often the patients reverted to baseline after only a few months, and the doctors would perform a second or even a third surgery. These underwhelming results made the doctors realize they needed to hone their procedure. They began operating on conscious patients and planning their next moves based on the patient's ability to perform certain tasks, like counting backwards, or singing a song, or reciting the Lord's Prayer. In 1941, 23-year-old Rosemary Kennedy became Freeman's 66th lobotomy patient with devastating results. Rosemary would never walk or speak clearly again and spent the rest of her life institutionalized. That same year, Clarence Charles Burlingame, one of the leading psychiatrists at the time, asked, "Do we use these as empirically as our predecessors did their leeches and their bleedings? Are we, in the light of others who come after us, going to be accused of being users of stupid, bizarre, or crude methods? Will they think us no better than quacks?" By 1942, Freeman and Watts had performed over 200 lobotomies. The pair claimed 63% of lobotomized patients improved, 24% were unchanged, and 14% were worse than they'd been before the procedure. In other words, 38% were unchanged or worse, yet they forged ahead. The first transorbital lobotomy was performed in 1946 with ice picks from Freeman's own kitchen. Dr. Watts walked into their shared offices to find Freeman, who was not a surgeon, operating on a patient who'd been subdued by electroshock therapy. The woman had an ice pick sticking out of each eye, which had been inserted to a depth of 7 centimeters. Freeman asked Watts to hold the picks while he took a picture, but Watts turned around and walked out. Freeman had angled the ice pick upward under the patient's eyelid against the top of the eye socket. Using a hammer or mallet, he then tapped the end of the ice pick until it punched through the bone into the frontal lobe of the brain, moving the ice pick back and forth to sever nerve fibers. Freeman believed his new transorbital procedure was more efficient, cost-effective, and less invasive than Moniz's frontal lobotomy, requiring less than 10 minutes and little recovery time. No neurosurgeon or hospital coordination was required. The intervention could be conducted anywhere, anytime, by practically anyone. Eager to train others in his transorbital technique, Freeman traveled to state hospitals across the country with his orbitoclasts. He would ask hospital staff to line up their psychotic patients and question them one by one before performing lobotomies on them, completing as many as 25 in a single day. One died on the table when he stopped the procedure with the orbitoclasts inside the patient's brain so he could snap a photo. The instrument slipped deeper into the brain, killing the patient. Freeman simply packed up his instruments and moved on to the next public demonstration. Walter Freeman didn't believe in all that germ crap, rarely washing his hands or donning gloves before procedures. He loved to shock his audience by performing bilateral transorbital lobotomies simultaneously, or switching from his dominant right hand to his left. In 1952, in what Freeman called his West Virginia lobotomy project, he boasted that he'd lobotomized 228 patients in 12 days for $20 a pop. The medical profession focused on the successful outcomes while ignoring the catastrophic results many patients and their families endured. And by the end of the 1940s, transorbital lobotomies were being performed at Johns Hopkins, the Mayo Clinic, and other renowned medical establishments around the world. In one incident, Dr. Freeman performed a transorbital lobotomy on one of his patients who had barricaded himself inside his bedroom with a hatchet and was threatening to kill his wife. Freeman had the police officers on scene hold the man down while he performed the procedure. When World War II ended, state hospitals became overwhelmed with soldiers who had returned home from the war with mental health problems. In 1943, with the cooperation of the Veterans Administration, Freeman began performing transorbital lobotomies on veterans. In the decade following the end of the war, roughly 2,000 young vets were lobotomized. By his own count, Freeman lobotomized nearly 3,500 patients, including 19 children under the age of 18. One was 4 years old. In 1954, a new drug called thorazine was being marketed as a chemical lobotomy. Coupled with the poor outcomes seen in many lobotomy patients, the procedure fell out of favor. Psychiatrist Dr. John Pippard said, "I got increasingly conservative about it because I don't think any of us were ever really happy about putting in a brain needle and stirring the works. Not a nice thought." British neurosurgeon Henry Marsh said, "It reflected very bad medicine, bad science, because it was clear the patients who were subjected to this procedure were never followed up properly. If you saw the patient after the operation, they'd seem all right. They'd walk and talk and say, 'Thank you, doctor.' The fact they were totally ruined as social human beings probably didn't count." Walter Jackson Freeman II died of colon cancer in 1972 at the age of 76. He went to his grave promoting transorbital lobotomy, convinced the procedure had a positive impact on his patients' lives.